Chairman of the Committee on Migrant Workers, I'm one with the Committee on Health in pursuing alternative and long-term solutions that will enhance the lives of our migrant workers. Sapit po ng Pasko hanggang bagong taon, marami sa ating mga OFWs ang umuwi, magbakasyon, makasama ang kani-kanilang mga pamilya. Subalit hindi lahat sila ay masaya. Marami sa kanila ay dumidiretso pa sa aking programa. Humingi ng tulong dahil para makauwi ay ubus na ang kanilang sahod. Bakit? Sabi nila, maliban sa dami ng kapamilyang binubuhay mula asawa, anak, magulang at kapatid, karasa na hindi tama ang pagbibigay ng benefits. Meron pa mga dagdag bayarin, kagaya ng contributions sa Philhealth na hindi naman daw nila napapakinabangan. Philhealth, meron na bang pakinabang sa ating mga OFWs? To address this issue, nagpatawag po ako ng isang consultative meeting last January 11, 2023 with the Department of Migrant Workers, Philhealth, and other stakeholders, representatives of Ws. And it has come to my attention the alarming fact that the Universal Health Care Act, this important piece of legislation, has failed to address their needs. That is why I'm here today to support the proposals for an amendment to the Universal Health Care Law, one that will address the specific needs of our migrant workers and provide them with the support and protection we require. Thus, I believe that we should exempt migrant workers from the requirement to pay contributions to Philhealth. As it stands, these workers are paying into a system that does not fully address their healthcare needs due to the nature of their work and their status as overseas workers. This is simply unacceptable, and it is time for us to provide them with a solution that works for them. We have to remember that these workers are the breadwinners of their families, which not only include their wives and children, but most often, they even support their entire clan. Yung halagang 8,700 pesos na annual contribution sa Philhealth, marahil maliit lang sa nakararami, pero mabigat na talaga yun sa kanila. Tapos, ibibigay pa sa Philhealth. In light of this, believe that it is not appropriate to impose further financial burdens on our citizens, including our migrant workers. That is why I'm proposing that we revisit the issue of premium rate increases and work together to find a solution that is both fair and equitable. I'm glad that the President suspended the rate increase for contributions and the income floor remains for this year. Malaking tulong po yun. This is merely a temporary solution. Socio-economic situation has yet to improve, and like I said, we need urgent solutions that will provide a more permanent effect. With the proposal amendments, I agree that the Philhealth contributions for migrant workers be voluntary, again, voluntary, and empower the Overseas Workers Administration to provide for their healthcare needs. It will ensure that our migrant workers have access to the support and protection they need when they need it most, while also freeing up funds that they can use to support their families and communities back home. In addition, I believe that we must also make use of modern technology and telemedicine to provide medical assistance to our migrant workers, no matter where they are in the world. This will allow them to access quality healthcare services without having to travel long distances or incur significant expenses. And it will be a major step forward in addressing the unique challenges they face. In conclusion, I believe this amendment to the Universal Health Care Law is a necessary and important step forward for our migrant workers, and I look forward to working with each and every one of you to make it a reality. Maraming salamat po at patuloy po akong sumasaludo sa ating mga OFWs in light of this. I believe that this is not appropriate to impose further financial burdens on our citizens, including our migrant workers. That is why I'm proposing that we revisit the issue of premium rate increase and work together to find solution that is equitable.
Thank you, Sen. Raffy Tulfo.
Anyway, I just like to, as the principal sponsored author of this Universal Healthcare Act, the reason why we have proposed amendments because we will only realize the flaws and the necessary adjustments that needed once it is implemented. Wala naman kasing perfectong batas. Ito'y gawa na din po natin. So now, this is the reason. And also, if I may address FWs and our workers, that I hope that they would understand that the time that we were drafting and deliberating on this law, what that was 2016, 17 up to 2019 before its passage, wala akong nakapredict magkakaroon ng pandemya. The world's economy, the Philippine economy was good. All of the data, all of the numbers that we used as a reference, kaya nga po sa premium, was based on the circumstances at the time. But because of the pandemic, it's not only the Philippines, it's not only our workers that struggled, it's the whole world. That's why we have to adapt to the situation. And that's the reason why we call this meeting, so that we can hear from DOH, what's the status of the implementation from Philhealth, will be the effects in case we will have just the premium heights, premium contributions. So, nila. Well, po siguro magsisinungaling yung mga official doon, ano? I don't think that they will lie to me na hindi ka pa po napunta rito. Pero ni isang official ng DOH, wala mong pong pumasyal dito para tingnan yung kalunos-lunos na kalagayan namin dito, kalunos-lunos na kalagayan ng mga pasyente rito. Di ba? So, 2 decades, sir, I don't know if you're lying or not, but anyway, pumunta man po kayo doon. Wala ng inyong DOH secretary, try to visit that facility. Waawa po yun. And then siguro pag nag-visit kayo doon, sir, makikita nyo na talagang yung needs ng hospital na yun ng mga bata nandoon at kung paano po ma-address yung mga pangailangan nila. Okay, sir?
Yes, sir, of course.
Pangalawa, sir, yung sa telemedicine. Okay, naman nila pinag-usapan ng telemedicine. Marami kasi sa mga OFWs nagreklamo sa akin na bakit kami inuobliga na magbayad ng premium sa Philhealth. Now, Senator JV sent me with these documents, and I think this document comes from you. Tama? Now, this contradicts dun sa mga reklamo ng mga OFWs na hindi rin nila pinapakinabangan. Napapakinabangan yung Philhealth premium na binabayaran nila. Kasi, example, 2021, 210 million ang totally collected premiums from the OFWs. Tama? And then the claims paid for that particular year was 1.42 billion. So, ibig sabihin, talagang sobra-sobra pakinabang ng mga OFWs. Am I right? And then same on 2020, 340 million, and the claims paid 1.36 billion. Is it accurate? Is this accurate record? And then it goes on and on. Pataas ng 2019, 1 million ang nakolekta. Millions to, right? Not billions. Yes, sir. 1.2 million. Billion. Sorry. Okay. 1.2 billion and then 7 billion ang claims paid. So lumilitaw na talagang sulit na sulit. Ano po? Mas malaki pa yung nababayan ng claims versus sa premiums collected. So, bakit po ang dami pa rin mga OFWs na nagreklamo na wala kaming pakinabang dyan, bayad kami ng bayad? Bakit saan yung bayad namin? So, hindi po tumutugma. Maliban na lamang kung ito ay tumutugma doon sa kumalat na mga balita noon na marami sa mga clinics at mga doktor nagpa-file ng mga bogus claims. Palagay nyo, Yusek?
Senator Tulfo may differ that to Philhealth kasi galing po sa Philhealth.
Probably, newly the president of Philhealth, Desma, can answer. Alam ko kaka-assume nyo lang, but siguro anybody from Philhealth can answer.
I will answer, Your Honor. Thank you, Your Honor, Your Honors. My answer would be human nature kasi po. People are always hoping for more. I think generally, regardless of your status in life, very few are really satisfied, no? Palaging sana mas mataas, sana mas marami, no? So I think I will answer your question by looking at the facts. And
Okay, so sir, may I interrupt just a minute? Just a second.
yes, sir.
Hoping for more, hindi kontento yung ibang tao. So, ibig mong sabihin, sakim at greedy ang mga OFWs natin? Is that what you mean?
Hindi po. I was saying,
So, then please don't use those words. Nakaka-offend po na hindi kontento kasi that's tantamount to saying na people are greedy and sakim in Tagalog.
I
Apologize.
apologize.
Support, sir.
I apologize for the comment, Your Honor.
Thank you, sir.
What I wanted to highlight, Your Honor, is I feel that I will have to disagree with the OFWs
Okay,
because
you can use that word, pero wag yung hindi makontento. Okay?
Yes po.
Kasi if sinabi mo hindi ba kontento, ang kasunod niyan, ang definition niyan ay sakim.
yes po.
Kasi yung mga tao hindi makontento, sakim ang tawag doon sa atin sa Tagalog. Ano po? So, in English is greedy. Huwag niyo pong bigyan ng that kind of image yung ating mga OFW especially.
Again, my apologies,
Thank you
Your
po,
Honor.
sir. Thank you po.
So I would like to use the chart which your good honor mentioned earlier, Mr. Chair, wherein it clearly shows for the year 2021, the premiums collected was 0.21 or 210 million, but the claims paid is 1.42 billion.
Okay?
So I think if we just base this on the chart, and this is a very accurate chart.
Okay?
It shows po that it clearly shows po na nagbe-benefit po yung mga tao
Exactly. So they benefit a lot.
sa claims ng Philhealth po.
So,
And
did they benefit more versus doon sa kanilang nababayarang premium? Okay, contributions. Okay?
yes po. And, I'd like to say much more kasi if you look
Much
at
more.
yung multiplier, ang laki po.
Ano?
Your Honor. Yes.
Oo nga, no? Okay.
So again po, and again, sorry for the language, but I feel our end, from PhilHealth's end, we are doing our part in serving the
Pero siguro, Mr. Ledesma, para maklarify kay Sen. Raffy, yung i-detalye na natin, yung claims paid, sino po ang kumukuha nito? Kasi OFW, sabi niya, nandun sila sa labas eh.
yes.
So ito bang claims paid are members of the family who are still here? I-clarify niya na lang po.
Kasi po lahat ng members ng PhilHealth 100% po, So kunyari may nagko-contribute, kung may mga anak, may mga pamilya.
Excuse me, sir. Can you just answer the question of the chair? Sino nagbe-benefit dito sa 1.42? Let's talk, we're talking about the 2021 year. The premiums paid by the OFWs, 210 million and then 1.42 billion claims paid. Sino po yung nag-benefit doon? Yun po ang tanong ni Mr. Chair. Yun sana ang tanong ko naunahan niya ako. Pakisagot lang po.
Yes po. Yeah.
Sino po yung mga nag-benefit dito sa claims paid?
If I can just given a few seconds, I will give you the breakdown po, So for
Hindi sir pakisagot lang po. Doon sa 1.42 billion na claims ng 2021 para sa mga OFWs.
Yeah.
Sino po nag-benefit doon? Mga OFWs ba o
or their families po.
or their families?
Yes po. You understand the question po. I'm just getting the exact.
Pakibigay lang po yung percentage, siguro po.
Yes po. I'm just getting the exact figures po. Sorry because I don't have it on top of my phone. It's already here po.
You know what sir, the answer? The possible answer for me? Family. Kasi hindi mo natingnan yung records mo. Kasi nga, the OFW will not benefit. The OFW themselves will not benefit because they're out of the country.
Yeah. Yes po.
The right answer doon sana is the family, the anak, the asawa, etc.
Yeah.
You have to look at your records.
Most likely po, I was going to say, sorry, Your Honor. Most likely po, it's the families.
Exactly.
In line with that po, if I may add po, since the families of the OFWs benefit, I think po, it's also tantamount or it's close to OFW benefiting kasi yung pamilya po nila.
No, sir. No, sir. Again, wrong choice of words. The beneficiary are the members of the family who are here, right?
Yes, po.
Doon na ibayad yung claims. doon sa pagpapacheck up, pagpapagamot ng mga families na dito. Never na makikinabang dito ang mga OFWs. Tama, because nandun sila eh, hindi inorin doon eh. But if you'll tell me, meron kayong tinatawag na teleconsult, consult sa telepono ng mga OFW, then pwede pa. Naniningin yung mga doktor doon sa teleconsult ng mga OFWs natin. Meron bang ganun programa ang Philhealth? OFWs?
Yes po. Just to...
Yes, sir, just answer, yes or no?
Yes. Yes po. The OFWs po can also avail the benefits abroad po.
They benefits abroad? How can they do that? How do they benefit?
Okay, if I can explain po,
How can they claim benefits abroad
yes po.
from PhilHealth?
I had just joined Philhealth. I know for a fact that they can avail. For the details po on how they can avail po, if I can ask my COO attorney.
Please, anybody can answer kasi
Thank you,
we
sir.
understand you just assume.
Yeah.
So anybody from PhilHealth who is more versed dun sa program can answer para maano niyo yung query ni Senator.
Thank you, Your Honor.
Attorney Eli Santos.
Sir Chairperson, good morning. Honorable Senator Raffy. Good morning, sir. Sir, an OFW is confined in a hospital abroad. He or she can claim, that OFW can claim for reimbursement for the hospital expenses here in the Philippines. All that is needed, all that are needed are the documents pertaining to the hospitalization of that OFW, Mr. Chairperson, Honorable Senator Raffy.
So, ilan na po sa mga OFWs ang nag-claim ng reimbursement? Do you have those records?
Mr. Chairperson, if I may.
Sige po, at magkano na po yung na-reimburse? Yung ba mga dokumento na yun ay legit? Tulad na kapapabalita, bogus, yung mga claims na bogus na i-file, binabayaran yung mga bogus claims, kaya nga muntik ka na malugi yung PhilHealth. So, please answer, sir. Attorney, sir.
Honorable Chairperson, Honorable Senator Raffy Tulfo, sir. At present, sir, we do not have the data.
Why not? You came here unprepared. You're a lawyer. You should be prepared.
Yes, sir. But we will submit the required data, the breakdown, sir, of how many of the OFWs submitted their claims for reimbursement here in the Philippines.
I need that record.
Yes, sir. We will provide the data, sir.
Yes, Attorney, please provide this committee so we can also provide Sen. Raffy. Lahat na nag-reimburse, nag-claim at yung nabayaran.
Yes, sir. We provide that, sir.
I'll tell you this, attorney. Maybe you don't know this.
Yes, sir.
Okay. Pag yung OFW natin nagkasakit doon sa, let's say, sa Saudi, yung amo nila, pinapagamot sila. Napa-hospital sila. And then pag uwi ng bahay, okay na sila. Ngayon, sasabihin mo sa akin na is OFW na pinagamot ng kanyang amo, na binayaran ng kanyang amo ng libre, ni-reimburse na? Kasi kadalasan ganun po, sir, eh. 99.9% ganun po yung nangyari na yung amo nila ang nagbabayad sa ospital. Amo nila ang nagpapagamot sa kanila ng libre. But there are times na yung amo nila, sinisingil sila. Yung amo nila, pinapabayaan sila. Pero that's only a portion of the numbers of OFWs na nagkakasakit. Mostly, yung amo nila ang nagpapagamot. And then libre. Kaya nga po, kung libre yun, nagpapareimburse ba sila sa inyo? And I need those records. And I need to know. Gusto ko makita yung sino po, kung meron man, gusto makita yung mga pangalan na nagpapareimburse at pumipirma para pwede kong isa-isang tawagan at puntahan para masiguro talagang sila ngayon at hindi po bogus yung claims. Attorney, sir.
Sir Chairperson, Honorable Senator Tulfo, sir, we commit to provide the data, sir, to this committee as soon as possible, sir.
But I would suggest to you, Attorney, yaman din lang na dito yung PhilHealth. Wala ho ba kayong teleconsult service sa mga OFWs? Dito magkakaroon sila ng pakinabang. Yung bang 24/7, doon sa mga basic illnesses. Kasi kung minsan, may mga OFWs natin, kahit na trangkaso yun, gusto lang may makausap sila para matanggal yung stress at panic nila. Na a doctor on the other line would tell them, ganito po yan, huwag kang mag-alala. Ito lang pong pwede yung inumin ng gamot. And then siguro, makipag-usap kayo sa gobyerno ng host country kung nasa inyo ating OFW, na i-honor po yung inyo pong isusulat na reseta. or kung ano man yung counterpart doon ng medicine sa bansa na yon. Kayo na ba nagagawa ng arrangement? Tama ba ako, PhilHealth? Meron ba tayong teleconsult service?
Mr. Chairperson, Honorable Senator Tulfo, at present, sir, we do not have it. We are planning to do it, sir. We realize the significance and importance of telemedicine during the pandemic, sir.
Then only then, magkakaroon ng pakinabang sa inyo ang OFW. Meron yung servisyo na yan. Unless, meron yan. Wala yan. Walang OFW ang may kinabang. Maliban lang sinasabi ng reimbursement. And then kung meron talaga, then gusto ko makita yung records. Noon.
Mr. Chair,
Yes, please, Mr. Ledesma.
I just want to make a quick comment, Your Honor. Based on the question of Honorable Senator Raffy earlier, we were able to extract the data po for 2021, and the breakdown po are as follows, no? For the members, the payment, the claims amount was 1.181 billion. Now, for the dependents, the claims amount is 526 million. So, to summarize po, mas malaki po yung claims ng member versus the dependents po. So to repeat po, it's 1.181 billion for the members and roughly 526 million for the dependents po.
Wait a minute here. Okay, so ibig mo sabihin, napapakinabangan ng halos lahat ng mga OFWs na premium nila. So sabi ko lang po kanina na marami sa ating mga OFWs hindi po nagagamit yung PhilHealth sapagkat yung amo po nila ang nagbabayad sa kanilang paggamot na papatok sa hospital. So, itin ko, you mean to say, ito mapagamot, ito mga OFWs natin, libre ng kanilang mga amo, sisigilin nila ang PhilHealth, abot sa 1.181 billion? Sir?
Mr. Chairperson, Honorable Senator Raffy Tulfo. Sir, the data shows in general the reimbursed amount in terms for the dependents and the members.
No, sir. Let's just talk about, sinabi kasi ni Mr. Ledesma na yung claims paid sa member, meaning doon sa OFW na nagbabayad ng premium, umabot sa 1.181 billion. Mas malaki pa kaysa doon sa relatives. Pero kung sasabihin nyo mas malaki yung dependents kaysa OFW, mas kapanipaniwala. This record, tingnan nyo ulit, magsalamin kayo sa. Kasi kung tama yung sinasabi nyo din, sa kilay ng mga OFWs natin, bakit umabot sa 1.181 billion yung claims nila, samantalang pag ginagamot sila doon sa Saudi, Kuwait, kung saan man lugar na yun, hindi na magpapayad. Libre. Wala pa ako narinig na OFW natin na pagbalik dito sa Pilipinas, sila ay nagkiklaim for reimbursement. I haven't heard of that. I have still to hear about that kind of statement from you, Attorney Santos, sir.
Mr. Chairperson, Honorable Senator Raffy Tulfo, sir. Sir, the data presented earlier by our President and CEO pertains in general to the amount reimbursed to members and dependents. It was for this reason, Mr. Chairperson, Honorable Senator Raffy Tulfo, that we requested that we be given the opportunity to provide this committee the specific data that pertains only to the claims of.
Mr. Chair, sir, hindi ba, Mr. Ledesma, kayo dyan sa PhilHealth, no, you guys are smart. Hindi mo kayo mapupunta dyan o malalagay dyan sa inyong mga posisyon kung hindi kayo smart. Di ba? Kasi meron mang ginagawang vetting ang Malacanang, screening for smart people to serve the different departments of our government, right? So, you being smart people, the two of you, it defies logic. What I'm saying is, you know, 1.181 billion to FWs na hindi naman sila yung nagbabayad ng gamutan, sila yung nasa abroad, kundi yung kanilang amo, and then pagbalik dito, pag-claim pa rin sila. I'm not questioning yung data ninyo. Na talagang, I'm sure meron kayong ganun data. However, I'm questioning the legitimacy of that data that you have. Yan ang ating napapabalita, yung bang korupsyon, malawakang korupsyon sa Philhealth, na may mga bogus claims. Ito na nga po siguro yun, na may nagdatail ng claims behalf of these OFWs na hindi naman. I-take yung kanilang pirma, kaya nga, I need those records. Tingnan ko, isa-isa kung kinakailangan. Tulatan ko yan at ng mga staff ko. Kung talagang sila ngayon nag-claim for reimbursement, baka naman hindi sila. Kapag hindi sila, dapat may makulong. Yes, sir. Mr. Ledesma, sir.
Your Honor. Your Honor, thank you very much for the question. We fully understand the point you're driving at in your question. So with all due respect, Mr. Chair, if we can be given some time, what I will do, I will personally submit, we will break down, we will extract in full detail all of the data broken down po para makita niyo po very clearly saan nanggagaling yung full figure po.
With the indulgence of, Sir Professor Manny, with the indulgence of Senator Raffy, ang concern niya kasi we know for a fact that Philhealth before, ang mga issues yan, mga bogus claims, yan yung mga nag-uubos ng pondo ng Philhealth, yung mga upcasing. So, siguro, what are you planning to do para masiguro lang na yung, baka mamaya daw kasi yung mga claims, baka galing sa mga bogus. What are you do under your leadership? Ano pong reforms that are being undertaken by PhilHealth para masigurado that those who are claiming talagang legit. Siguro yun ang concern ni Sen. Raffy. Baka daw kasi yung mga bogus, yung mga dating issues, no? Ano pong ginagawa niyo?
And before you answer that question, Mr. Ledesma, sir, January 11, 2023, dito hindi kayo kasama, consultative meeting, and I already requested for those records. Bakit hindi po dala? Hindi po kayo sinabihan ng inyong mga tauhan na napag-usapan ito at maaaring itatanong ko ulit. So, for the second time, I'm asking you. So, sa sunod nating hearing, baka wala na naman.
Again, thank you for your question, Mr. Honor, Your Honors. First of all, we will comply. We will submit the data as soon as possible, Your Honor. Maybe if you can give us even just a few days, Your Honor. Like I said, I will personally see to it that the data is complete, it's in detail, and it will be submitted to the good committee. No?
Ano po sa question ni...
Yes. Finish first your question, Your Honor. And you're saying last January 11, you requested for that to be submitted. I'd like to apologize in behalf of the group, no? Why it was not submitted. But again po, maybe you can be accountable for after a few days we will submit that po. To answer the question,
Thank you, sir. Thank you, sir.
You're welcome, Your Honor. To answer your question, Senator Ejercito, no? We're doing a lot of things, but mainly yung regarding the bogus or the fraudulent claims, no? Even before I joined, I know that was one of the issues that was brought forward to my attention, no? So one of the things we're principally focusing on now is the full computerization and digitization of PhilHealth, no? A lot of this po kasi yung pagka-recording, yung delays, a lot of that is really to do medyo backdated po kasi yung sistema namin, no? So it's susceptible to I'm not saying there was fraud or there is connivance and all that, but it's susceptible. So we are prioritizing that, and in fact we have met with both private sector, with government. We've been coordinating very closely with the ICT, Sec Ivan, and we are on the right path. Again, these things take time, but I can really promise this good committee that we are addressing it, we are working on it, and we are trying our best to move it forward. That's all, Your Honor. Thank you po.
Maganda yung sinasabi mo, computerized na yung pong sistema nyo dyan sa PhilHealth, right? Kahit anong klaseng computer ang ilalagay nyo dyan, pero kung yung nag-operate ng computer at yung mga tao dyan, ang mga loko-loko, nandiyan pa rin, tuloy-tuloy pa rin korupsyon, tuloy-tuloy ang ligaya. So if I were you, kailangan nyo pong magwalis. Alisin nyo po yung mga loko-loko dyan. In fact, nakakatawa nga Mr. Chef, panahon ng pandemic ata to, na yung isang sinabing corrupt ay na-promote. Corrupt na nga. Diba? It's not you, sir. Not you. So, siguro po, maglinis kayo. Linisin niyo po yung PhilHealth. Mag-imbestiga po kayo sino-sino po doon yung involved sa korupsyon. Linisin niyo po yun. Then, maniniwala ko na maging maayos na punta po ng PhilHealth. Maniniwala kaming lahat. Okay, sir. Thank you, Mr. Ledesma.
Can I comment, Mr. Chair?
Good, sir.
We hear you loud and clear, Senator Tulfo, Your Honor. When I had accepted this position po, actually po I was actually personally handpicked by the President, no, for this position, and I actually promised them that I would do my best to continue moving, continue all the good things that PhilHealth has done, and if ever I find out that there are wrongdoings or shortcomings, we shall definitely address it po, no. I can assure that this good committee, I'm asking sana in return from the good senators, and I said the same thing to the good congressmen, no. Sana po bigyan niyo kami ng pagkakataon, no. If the president of the Philippines has a so-called 100-day honeymoon period or 200-day honeymoon period, parang po kami rin. Parang give us this chance, no. We hear you loud and clear. I don't know if there is all this talk. It's there, if it's not there, no. I have been actively looking since I had joined, although I'm very new, no. So far po, to be honest, wala po akong nakikita, no. In fact,
Wala po kayo nakikita ng corruption sa PhilHealth? In mga previous?
as far as from ganito po, I have joined less than 2 months.
I know, sir, pero wait a minute. I'm offended. Even the taong bayan are offended. Kung sabihin niyo po, samantalang deklarado na po yan, nag-hearing na yan dito, at marami ng mga ebidensya na papakita na may mga bogus claims na ipa-file ng mga doktor at hospital, and then sabi mo, wala ka pa rin nakikita. Sir,
Mr. Chair, yes. Sir, can I cite an example, no?
sir, kasi sabi mo, wala pa rin nakikita. So, you're making stupid out of us. Out of all of us. Kasi, na-media na po yan. Malat na po yan. Paulit-ulit na lang yan sa media na mga bogus claims, meron na nga po mga na-ombudsman, meron na po mga inimbestigahan. And sabi mo, wala ka pa rin nakikita. So, kinukonta mo po yung mga records na lumabas na with pieces of evidence showing talagang it existed, and yet now you're saying, wala ka nakita, and then you're asking for honeymoon period. Of course, I'll give you honeymoon period. Why am I doing this? Expose kita, ito, wala ka palang nakikita. Now, this is your opportunity na para makita mo, ma-expose ka doon sa mga nangyaring kamalian doon sa PhilHealth para hindi na maulit on your watch. Pero sir, first, tanggapin mo na meron talagang problema sa PhilHealth. Huwag po yung in denial eh. Lang agad, sasabihin mo wala, malinis kami. Then, I'm sorry sir, then you're not good for that position. For you to be able to clean an organization that has been punished with corruption, first you have to accept that there was really corruption. Do not be in denial. That's the only way na para masolve mo po yung problema. Gapin niyo po muna, and then saka ko'y maglinis. Hindi yung pwedeng walang nangyaring problema rito. Then wala ka malilinis.
Noted po. What I wanted to say po was this, no. I understand fully, and I'm with you po. If you want to solve a problem, you have to admit first that there is a problem and what is the problem, no. Now, what I'm saying po is, I had just joined PhilHealth. I'm thoroughly looking into everything, because again, one of the even before I joined, I did a lot of reading. I talked to a lot of the ex-PCEOs, the ex-PhilHealth, and present PhilHealth employees, and I did my own research po, no. Now, what what I'm doing now is, till there is hard evidence, I'm not a lawyer po, no, but until there is evidence and proof, I don't want to falsely accuse anybody. No. If I may cite an example po, no.
Sir, meron na po nangyari mga investigasyon. I was expecting you to say na yung mga iimbestigahan ko. Alright? I will do my own investigation. Yes, meron mga ganun balita na corruption involved. Then, kung sino man mga yun, will cooperate and I will investigate. Sir, parang pinagtatakpan mo eh. Ano ba yun? Sorry, sir. Pinagtatak mo, parang sinasabi mo, kasi sabi mo, unless makita ka ng hard evidence, hindi ka magsasabi ng kahit na ano, those people from Philhealth who were accused of corruption. Mismo na si Presidente Duterte, inadmit niya na may corruption eh. Diba? Kaya nga gumawa siya ng paglilinis. Gumawa siya ng pagpapaimbestiga, naglagay siya ng mga bagong tao. Even the president was aware, fully aware that there was. And then here you are, sinasabi mo wala, unless na mayroong proof. Di ba, sir?
Thank you, Sen. Raffy Tulfo. Anyway,